Good evening. Welcome to Monday Reading Live. My name is Vandana PS, one of the reading trainers from Neethu's Academy. Yes, so how was your weekend? Weekend ഒക്കെ എങ്ങനെ ഉണ്ടായിരുന്നു? Are you guys doing additional materials every day? Materials ഒക്കെ ചെയ്യുന്നുണ്ടോ? Anyway, so we have exam coming this week. ഈ ഒരു വീക്കിൽ നമുക്ക് എക്സാം ഉണ്ടല്ലേ? So yes, so in this week we'll be dealing with exam model materials for part A as well as part B. Okay, so I'll give you 2 minutes for the completion of a sample question from part B. So please do the question, then we will discuss the answer. So here comes the question. Done. And what is the third step? Not audible, right? Okay, I think it's audible now. Yes, Neethu and Josna. Hi, Sijana, good evening. Anyway, so what is the first step? So once again, the first step is we can read the question. Second step is underline the keywords from the question. So my keywords from the question, which are email as well as just in case boxes. Okay. Yeah, not audible. Okay, so what about others? Am I audible? Hi, Aranya, good evening. Yes. Okay. So yes, so what is the first step? So the first step is we can read the question and then you can underline the keywords. Okay, now audible. Thank you. So what is the first step? We can read the question. Second step is we are underlining certain keywords from the question. And what is the third step? And the third step is, according to me, third step is most important. This third step is important. Okay, and what is the third step? Understanding the question. Okay, so without understanding the question, definitely your answer will be wrong. Question answer correct. So that is the most important part of part B, understanding the question. So how can you understand the question? With the help of the keywords, first of all, we are just thinking about, and that cognitive thinking or the function is here. Which category of question is it? The category of question. Which category of question? And this is from the third category, which is an email. Okay, this is an email. So for my students, what my students are doing, they will do one thing on the side of this question, mark. So how they are marking it, I'll show you. And this is from the third category, so they will mark it as third. Okay, so they have a code language for that. I'll give you what is it. And this is from the third category, which is an email. So then they will write the first letter, which is E. So third category, email. And they will underline, okay, they will say, oh, which lines are important here? And they will always say the last lines are important. Okay, so last lines are important, so we can mark it as L. And what are you reading for in the third category? Or what are you reading for in an email? email? We are reading for the purpose. And this is the code language. Okay, so third category, which is an email, and last lines are important, we are reading for the purpose. Purpose, which means the overall idea. So we have to by heart it. So whenever there is a question from an email category, this code will be there in the mind. So third category, email, last lines are important, we are reading for the purpose, overall idea. Clear? So coming to this one, so this is how we are understanding the question. So what is an overall idea of this just in case boxes here? What is the information from that? And second thing is that you can just carefully look into this question as whether this is a incomplete question or a complete question. Either a complete question or incomplete question. I can say this is an incomplete question because there is no full stop at the end of the question. There is no question mark at the end of the question. So I can say this is an incomplete question. Okay, so whenever you came across with an incomplete question, you can always connect with your options. Okay, so we are just reading for the overall idea or the purpose, then you can connect with your option. That is the next step. So what is how we can connect with your question? So just in case boxes includes information on the rationale for providing them. So my keywords, rationale which means the reason why we are providing just in case boxes. That is option A. Rationale, providing. Option B, this includes information on a change in policy regarding them. So my keywords, change, policy. And this box includes information on some concerns raised about them. So my keywords, concerns raised. So these are my keywords from these three options. So likewise, we can connect with your options as well as we can underline some keywords from the same. Clear? Then what is next? Reading the paragraph. So first one is read the question. Second one, underline the keywords from the question. Third one, understand the question. And fourth one, we are just reading the options, underlining the keywords from the options, and we are going to read the paragraph. All right. So I'm going to read the paragraph. So carefully, just read along with me. Okay. 2. See, so what is an email? In the email, so email, which means we are sending an information to someone. So there will be a sender and a receiver, as well as there will be a subject line. So what is a subject line here? It's all about just in case boxes. Subject line is always important in an email. Okay, because subject line is actually the question. What is the information? What is the overall idea? What is the purpose? That purpose is the subject line. So subject line is very important. Alright, so 2, staff working offsite. So this, who is the receiver here? Staff. Who is the sender? Hospital board is the sender. And this is the purpose, subject line, just in case boxes. Now I'm reading the paragraph. Like many areas nationally, we are now developing a system of just in case boxes to support anticipatory prescribing and access to palliative care medication for patients with common symptoms in the end of life phase. Example, pain, agitation, breathlessness and nausea. So why? What is the reason for just giving or providing these boxes here? Very clearly mentioned, we are providing this to support anticipatory prescribing and access to palliative care medication for patients with common symptoms in the end of life facing these and this and this. So from the first line, maybe option A. I have no idea, maybe. Then second sentence, adequate quantities of appropriate medicine will be prescribed for the patient. So why? Again, the question is there. Why? For the patient and stored in identifiable container just in case box in patient's home. Carers and patients need to be reassured that prescribed medicines have been prescribed just in case that may not be needed. Patients and carers will be provided with a contact phone number to ensure timely access to symptom assessment and management. That's all about just in case boxes. Okay, and what about option B? A change in policy regarding them. Where is it mentioned? There is a change in policy regarding this just in case boxes. So, we can eliminate option B because it is not mentioned anywhere in the paragraph. Have you seen this here? No. So, we can eliminate option B. And what about option C? Some concerns raised about them. So, what do you mean by concerns? Concern. I have a concern. So, concern, which means a query or a doubt, or you can say the original meaning is a worry, a tension. So, that is concern. I have a concern, which means I have a tension, a worry. So, here again I have not seen anything related to any concern. So, not mentioned again. My answer is option A. Okay, that's called elimination method. What is elimination method? So along with reading the paragraph, you guys can connect with your options and you can do one thing: elimination, mitigation, deletion. Okay, deleting certain options. Answer is option A. The reason for providing them which means what? Just in case boxes. So why they are providing just in case boxes? That is the purpose. Okay, if you are a student who able to know, okay, what is the subject line? That is the answer. Alright, so answer is option A. Hi Jishi, good evening. Yes, Monita, Aranya, your answer is correct, which is from, yeah, it's option A. So any doubts regarding part B? No doubts, right? So this is, or these are the 5 simple steps to do part B. Clear? Yes, Drishya, which is option A. Very good, Drishya. So now we are moving to a self-prepared material for part A, and this is one of, the toughest materials which I have prepared for you. So let's move to that one. Yeah. So we have paraneoplastic syndrome. Yes. Good evening. Yes, Amrita, which is option A. Yes, very good, dear. So paraneoplastic syndrome. So how was this material? So even though I can say this text, all of these texts were quite not that much lengthy, a very short text, but still the questions are a little bit confusing and tough, right? I know. Yes. So let's do skimming and scanning method. Let's apply this particular method. How can we how can we apply this method called skimming and scanning, and how it will help you to find out your answer? Yes. So what is part A? Okay, and what are the importance of doing part A? What are the keywords that we can underline from each of these texts, and how we can find out the question answers with the help of the strategy. All right, so in this video, I'm going to do that. Hi, Elizabeth. Good evening. Yes. Material cheydo. So did you all take the printout of the material from Neethu's Academy reading page? So every day we will upload the material there in Neethu's Academy reading, and you can download the material from there. So please do the material and enter the live session. So if you have any doubts regarding anything, you can contact us on the given number, as well as all the previous live sessions are there, so you can attend them. You will get a lot of idea, a lot of knowledge, Yeah. Very good, Monida. Done. So how was it, dear? How was this particular paraneoplastic syndrome? Was it easy? Yeah. So coming to part A. So what about part? What do you guys know about part? I think in the comment. So what is your concept, or what is your notion regarding part A? Comment. Yes. What do you guys know about part A? What about the time, and what strategy we are using here? How many questions we have, and any other methods you know? And what is your time management? നിങ്ങൾ എത്ര മിനിറ്റിനുള്ളിലാണ് യൂഷ്വലി പാർട്ട് ചെയ്ത് കഴിയുന്നത്? എനിവൺ ഇസ് ഫൈൻഡിങ് ഇറ്റ് ഡിഫിക്കൾട്ട്? അതായത് നിങ്ങൾക്ക് ഡിഫിക്കൽട്ടായിട്ട് ഫേസ് ചെയ്യുന്ന ആരെങ്കിലും ഉണ്ടോ? ഹായ് ക്ലറീന, ഗുഡ് ഈവനിങ്. സോ പാർട്ട് ഈസ് ഡിഫിക്കൽട്ട് ഫോർ മീ മാം, അങ്ങനെ ആരെങ്കിലും ഉണ്ടോ? പാർട്ട് ഈസ് ഡിഫിക്കൾട്ട് ആൻഡ് ഐ ഡോണ്ട് ഹാവ് ദ ടൈം മാനേജ്മെൻറ്റ്. Any such concerns? So what do you guys know about part A? Please tell me. So yes, Amrita, very good, dear. So we have only 15 minutes. Only 15 minutes, yes. Okay, so we have only 15 minutes for doing part A. Then, what else you know? Where endokka namukku ariyam regarding part A? 15 minutes? Yes, Nitin. 15 minutes, 20 questions. Yeah, 15 minutes, 20 questions. Anything else? Yes, Monida, part A is difficult for you. Okay. So, I don't know whether you guys know about it. Once I've told about this. I don't know whether you have heard. Actually, part A and part C have some psychological connections. നമ്മുടെ ബിഹേവിയറും നമ്മുടെ ക്യാരക്ടറിസ്റ്റിക്സ് ഒക്കെ ആയിട്ട് ചെറിയൊരു കണക്ഷൻ ഉണ്ട് പാർട്ട് എ ആൻഡ് പാർട്ട് സി. Can you tell me what is it? I can tell your, psychological or that characteristic which you have. അതായത് normally we are saying part A, as you know, we have only 15 minutes of time, so this is like a quick reading and everything is done very so quickly. നമ്മൾ പെട്ടെന്ന് കാര്യങ്ങൾ ചെയ്യുന്ന ഒരു ഏരിയ ആണ് ദാറ്റ്സ് പാർട്ട് എ. So if some students I found that okay, they are very restless and എല്ലാ കാര്യങ്ങളും അവരിങ്ങനെ എന്താ പറയുക spontaneously they are just doing things. Okay, so for them part A is very easy. പെട്ടെന്ന് കാര്യങ്ങൾ ചെയ്യുന്നു, എന്താ പറയുക, പെട്ടെന്ന് വായിക്കുന്നു, ജസ്റ്റ് ഡൂയിങ് ഫാസ്റ്റ് റീഡിങ് ആൻഡ് സർട്ടൻ ഐഡൻറ്റിഫൈങ് സർട്ടൻ കീവേഡ്സ് ആൻഡ് ജസ്റ്റ് ഡൂയിങ് എവറിത്തിങ് വെരി ഫാസ്റ്റ്ലി. that's their nature. They can easily do part A. But what about part C? Just the opposite. So part A difficult ആയിട്ടുള്ളവർക്ക് part C is easy for them. And whenever you find part C is difficult and part A is easy for them. കാരണം എന്താണ്, ദിസ് ഇസ് ടു ക്യാരക്ടറിസ്റ്റിക്, നമ്മുടെ അത് ഒരു ഫീച്ചറാണ്. ഓക്കെ, സോ പാർട്ട് എ വി ആർ ജസ്റ്റ് ഡൂയിങ് എവറിത്തിങ് സോ ക്വിക്ക്ലി, ദാറ്റ് ഇസ് അവർ നേച്ചർ. ഇഫ് പാർട്ട് ഈസ് ഈസി ഫോർ യു, ദാറ്റ് ഇസ് യുവർ നേച്ചർ. യു ആർ ജസ്റ്റ് ഡൂയിങ് എവറിത്തിങ് സോ ക്വിക്ക്ലി. ആൻഡ് വാട്ട് അബൌട്ട് പാർട്ട് സി? ഇഫ് യു ഹാവ് ദറ്റ് പേഷ്യൻസ് ആൻഡ് എവറിത്തിങ്, നമ്മൾ ഭയങ്കര ക്ഷമയായിട്ടിരുന്ന എല്ലാ കാര്യങ്ങളും ചെയ്യുന്ന ഒരാളാണ്, വായിക്കാനുള്ള ഒരു ടെൻഡൻസി ഉണ്ട്, ആൻഡ് വി ആർ ഡൂയിങ് എവറിത്തിങ് വെരി സ്ലോലി, ദാറ്റ് ഇസ് യുവർ നേച്ചർ ആൻഡ് യു ക്യാൻ സ്കോർ ഇൻ പാർട്ട് സി. അല്ലേ? Yeah, that's it. Okay, so what we can do is, in part A, we should practice speed reading. Okay, that particular technique, actually speed reading, it's a skill. I can say it's not a technique, it's a skill. Okay, in a single day, you can't do fast reading or speed reading. With days, with the help of a lot of days, you can build this. Okay, ഒരു 1 week or 2 weeks എടുക്കും. ആ ഒരു സ്കില്ല് നമുക്ക് കിട്ടാൻ വേണ്ടിയിട്ട്. സോ പ്ലീസ് ഡു പ്രാക്ടീസ് ഫാസ്റ്റ് റീഡിങ് ഓർ സ്പീഡ് റീഡിങ്. Then it will be easy for you. Okay. So coming back to part A. So 15 minutes and how many questions? Yes, Shiji, 20 questions. Yes, very good, Shiji, 20 questions. And this 20 questions actually they have categorized into 3 different sessions. 3 sessions ആയിട്ട് അവർ categorize ചെയ്തിട്ടുണ്ട്. As you can see here, 1 to 7 set of questions can be called what? Match the following questions. ഓക്കെ, ഇതിങ്ങനെ ഇൻബിൽറ്റ് ചെയ്തിരിക്കുകയാണ് നമ്മുടെ മൈൻഡിൽ. ഓക്കെ, 1 to 7, 8 to 14, 15 to 20. ഓക്കെ, സോ എപ്പോൾ ചോദിച്ചാലും പറയാൻ റെഡി ആയിരിക്കണം. ഓക്കെ, 1 to 7 എന്താ എന്ന് ചോദിച്ചാൽ 1 to 7 മാച്ച് ദ ഫോളോയിങ് ക്വസ്റ്റൻസ്. സോ വാട്ട് ഇസ് മാച്ച് ദ ഫോളോയിങ് ക്വസ്റ്റൻസ്? യു ക്യാൻ റീഡ് ദ ക്വസ്റ്റൻ, അണ്ടർലൈൻ ദ കീവേഡ്സ്, ഫൈൻഡ് വിച്ച് ടെക്സ്റ്റ്. അല്ലേ? സോ യെസ്, യാ. So this is what is the instruction here. For each question 1 to 7, decide which text, whether it is A, B, C or D, the information comes from. You may use any letter more than once. In which text you can find information about. So that's all about 1 to 7 set of questions. All right. And what about next one? 8 to 14 set of questions that can be called short answers. Short answer questions. Answer to the question. അവിടെ നമ്മൾ കൂടുതൽ കാര്യങ്ങളൊന്നും നോട്ട് ചെയ്യാൻ പോകണ്ട. You can just write what is the correct answer. Just answer to the question. That's it. Okay? And what is the maximum words here? You can write in a word or a short phrase. So, what is a phrase? As you guys know, phrase which means combination of words. Short phrase which means maximum 2 to 3 words. If you're writing more than 3 words, no chance for getting marks. Same with 15 to 20. Fill in the blanks. Yes, Rose Maria Benny. Hi, Rose Maria. Yeah, it is short phrases. And what about 15 to 20? Same instruction here, which is you can write in a word or a short phrase. Again, maximum 2 to 3 words. I hope it is clear. And here we are just finding which word is missing or which words are missing. ഏത് വേർഡാണ് ആ സെൻറ്റൻസിൽ നിന്ന് മിസ് ചെയ്തിരിക്കുന്നത് or which words are missing from the sentence, we are going to find out that. അത് മാത്രം നമ്മൾ ഐഡൻറ്റിഫൈ ചെയ്താൽ മതി. Don't add anything extra. കൂടുതലായിട്ടൊന്നും ആഡ് ചെയ്യരുത്. Okay. And coming back to the material. And for the completion of part A, 20 questions within 15 minutes, we need a method or we need a strategy. We need a technique for that. And what is the name of the strategy? That's called skimming and scanning. Okay, skimming and scanning. ഇത് നിങ്ങൾ കേട്ട് ഇങ്ങനെ മടുത്തിരിക്കുന്ന ഒരു കാര്യമായിരിക്കും മേ ബി, എനിക്കറിയാം. ബട്ട് മെജോറിറ്റി ഇപ്പോഴും നിങ്ങൾക്ക് അറിയില്ല വാട്ട് ഇസ് സ്കിമ്മിങ് ആൻഡ് സ്കാനിങ്. Okay, and you guys are saying, okay, we don't have any time management, ma'am, and this is very difficult to understand. What is it? Because you know, you don't have any idea what is skimming and scanning. If you are a student who know very well, okay, what is skimming and scanning, definitely you can answer 20 questions within 15 minutes. Definitely you'll get 20 out of 20, no doubt. Plus, you have reading habit also. Now, coming to that one. If you don't have any reading habit and then you guys are applying all these techniques and everything, your mark will be in 290. അവിടെ നിൽക്കും. There will not be any improvement. കൂടി വന്ന ഇവിടം വരെ കയറും. 290 to 340. Then അവിടെ നിൽക്കും. Okay. So whenever you start this habit called reading, this 340 can be എങ്ങോട്ട് പോകും? Above 400. No doubt. So currently just imagine in which level you guys are standing. നമ്മൾ എവിടെയാണെന്നുള്ളത് നമുക്കേ അറിയൂ. Think about it. Okay? Am I here? ഞാൻ ഇവിടെയാണോ? Or I'm here? Or I just want to reach here? Think about it. അല്ലേ? ഇവിടെ നിൽക്കുന്നവർ എന്താണ് വേണ്ടത്? എവിടെ നിൽക്കുന്നവരാണെങ്കിലും whatever in which level you guys are standing, you have a aim. I need to score more than 400. That's my aim. Okay, reading is not a very tough module, so definitely you can score 500 out of 500 for reading, no doubt. But if you are a hard-working student, so please do hard work to score 500 out of 500. Definitely then you can score above 400. Okay, so that's that. So coming to this one, skimming and scanning. So what is skimming and what is scanning? So skimming, which means speed reading or fast reading. So we are just quickly reading everything That's called skimming. And if you're underlining certain keywords, some important words from these different 4 texts, that's called scanning. So what is skimming and scanning? That is skimming and scanning. And so what are the important words from text A? ഞാനിത് വായിക്കാം. So please do comment and please don't lazy. നമ്മളിങ്ങനെ മടി പിടിച്ചിരുന്നാൽ nobody is gonna write this exam for you. നിങ്ങൾക്ക് വേണ്ടി ആരും ഈ എക്സാം എഴുതാൻ പോകുന്നില്ല അല്ലേ? ആരാ എഴുതാൻ പോകുന്നത്? നമ്മൾ തന്നെ എഴുതണം. So we are going to write this exam. We are going to pass this exam. We are going to clear this exam. We are going to the dream country which we need to go. So please do comment your answers. Alright, I can correct you. So yes, what are the keywords from text A? Important ആണെന്ന് നമുക്ക് തോന്നുന്ന കുറച്ച് keywords ഉണ്ടാവും. According to a strategy. So what is a strategy? You can underline all the heading. Underline all the subheading. Mark all the numbers mentioned. Mark all the signs and symbols. Then all the abbreviations, names, brackets, italicized or bold words. The words that indicate time. See, when is a word that indicate time. So indicating time. The word that indicate experiment related words you can underline. Okay, see process. The words which indicate research related words you can underline. And the words, not the words, the first and last line of each and every para as well as all the bullet points. So this is a strategy which we can apply while you read it. Skim and scan part A. So paraneoplastic syndrome is a collection of signs and symptoms that may arise as a consequence of having cancer. Symptoms occur when malignant tumor triggers changes in your body that are not directly caused by the cancer itself. The tumor may secrete a hormone or a protein that affects a particular body system. Often, with paraneoplastic syndromes, your immune system releases antibodies to destroy the tumor. During this process, the antibodies also damage healthy cells' autoimmune response. So these are my keywords from text A. Only, maybe 10 keywords okay kannu. Yeah. Paraneoplastic syndromes can impact multiple body systems and organs, including your nerve system, endocrine systems, kidneys, bones, joints, skin, and blood, etc. Often the symptoms of paraneoplastic syndrome are the first signs of cancer. You're more likely to have a paraneoplastic syndrome if you are middle-aged or older, you have a lung, lymphatic, ovarian, or breast cancer. The same factors that increase your cancer risk can increase your chances of developing a paraneoplastic syndrome. So these are my keywords from text A. Now text B. Diagnosis. Neurological exam. Your provider may ask you to perform specific tasks to check how your nervous system functions. They will want to judge any change in your abilities related to strength, memory, and coordinating. Imaging. Your provider may use imaging tests such as CT scans, MRIs, and ultrasounds to look for a tumor. Look for, which means search. Tumor that may cause symptoms. Then blood test. Blood test can reveal suspicious findings that suggest a tumor that confirm you have antibodies linked to paraneoplastic syndromes. Blood tests can help your provider rule out, which means find out, other conditions that may be causing your symptoms like an infection, hormone disorder, or metabolic disorder. Spinal tap or lumbar puncture. In some instances, your provider may perform a spinal tap test to your cerebrospinal fluid for signs your antibodies attacking healthy cells. During spinal tap, your provider inserts a needle into your lower back to withdraw a fluid sample. So these are the keywords from text B. Later, your healthcare provider will test the liquid for antibodies. Text C. So we have a lot of therapies mentioned here to manage paraneoplastic syndrome include corticosteroids, medications such as cortisone or prednisone that reduce inflammation, immunosuppression, drugs that decrease your body's immune response. The drug therapies your provider prescribes will be tailored to your paraneoplastic syndrome. Then intravenous immunoglobulin treatment that destroys the harmful antibodies causing the syndrome. During the procedure, your provider gives you a shot of healthy antibodies that destroy the harmful ones. Then plasmapheresis. A procedure that decreases the number of antibodies by removing plasma or liquid from your blood. The plasma contains antibodies that damages healthy tissue. Then physical and speech therapy, muscle exercises that can help improve functions like speech and movement. You may need this therapy if you have a neurological paraneoplastic syndrome. So these are the keywords from text C. And what about text D? Epidemiology. The reported frequency of paraneoplastic syndromes ranges from 10 to 15% and 2 to 20% of malignancies. Neurological paraneoplastic syndromes are estimated to occur in fewer than 1% of patients with cancer. The true incidence of deaths and complications related to paraneoplastic syndrome is unknown. No race or sex predelication or paraneoplastic syndromes is reported. People of all ages may be affected by cancers and their related paraneoplastic syndrome. So these are my keywords from text A, text B, text C, as well as text D. Clear? So now we are moving to the question answers. So I hope I have underlined all the important words which I found important from all these texts. So now it's time to read the question and we can discuss the answers. First one. What advanced medical procedure is designed to replace harmful antibodies with beneficial ones? Okay, so what is the question? Advanced medical procedure is designed to replace harmful antibodies with beneficial ones. So where you have seen these kind of keywords? Advanced medical procedure, which means in simple word I can say medication or intervention. So medical intervention that replace or substitute harmful antibody, which means the harmful one or detrimental antibodies with beneficial ones. That means detrimental, what is the opposite of harmful? Healthy antibodies. So where is it mentioned? Harmful antibodies, healthy antibodies, or medical intervention, the procedure. Where is it mentioned? Any idea? Yes, hi Sharika, short phrases. Yes, Rose Maria, 3 words, short phrases. Yeah. So what about first one? What is the answer here? Where is it mentioned? First question. So yes, very good Shiji, your answer is correct. As you can see here in text C, yes, Sharika, Shiji, Nitin, yes, Nitin, very good. Okay, Sanila, text C. Yeah. Now, my question is, where is it mentioned in text C? Every another mention healthy antibodies, harmful antibodies, yes. Intravenous immunoglobulin. See this point? This is a medical intervention. Treatment that destroys harmful antibodies, keyword from the question. Causing syndrome. During the procedure, your provider gives you a shot of healthy antibodies with beneficial ones. So, answer is mentioned in C. Clear? Yes, Shijo, it is from text C. Amrita, Priyanka, Monita, Swati, Rose Maria, Drishya, Sanila, Nitin, Sarika and Shiji. Excellent, very good. Even though this is a little bit confusing, your answer is correct. Very good. Second one, sophisticated modalities employed in the detection of paraneoplastic syndrome. Even though we have some unfamiliar words here, it's not unfamiliar, but still we are not even using this type of words in day-to-day activities. We are using the word in the sophisticated and modalities. So what are the modalities or what are the procedures employed, used in detection, diagnosis, identification of paraneoplastic syndrome? So where they've mentioned about this detection of the syndrome, identification of the syndrome, diagnosis of the syndrome. Yeah, so what are the different diagnostic procedures, that is sophisticated modalities employed, which means used? Yes, let me know answers please. Sophisticated modalities, detection. Yes, Nitin, very good. Answer is correct. And your answer is correct, Nitin, because it is mentioned here in the subtitle or the title, diagnosis. What are the sophisticated modalities mentioned here? You can go for a neurological exam, imaging is there, blood test is there, spinal tap is there. So these are the different procedures or modalities for finding out this condition. So answer is mentioned here in B. Yes. So how many correct answers? Sanila, Swati, Sarika, Shiji, Rose, Maria, Nitin. Very good. So what about Monita, Shiji and Shijo? Yes. All right. So answer is B. Third one, intricate factors. Intricate, I can say this is a negative meaning, which means some difficulty, complication, complicated factors that leads to the onset of paraneoplastic syndrome. So my keywords, intricate factors as well as onset, starting. So where is the mentioning of starting of paraneoplastic syndrome? Even though we have no idea what is intricate and factors, then you can look for the another keyword here, onset, starting of paraneoplastic syndrome. So where they have mentioned about the starting of paraneoplastic syndrome here. Any right answers? Yes, Monita, answer is correct. So what about third one? Yes, Drishya, your answer is correct. Second one is B. What about third one? No idea. Where is it mentioned? The complicated factors, or these are the factors that can lead to the onset of this syndrome. B, Anna. Is it B? Yes, Sarika. Second one is B. What about third one? No. Third one is mentioned in text A. Very good, Shiji. Your answer is correct. So what are the intricate factors that can lead to this particular onset of this condition, which is mentioned here? You are more likely to have a paraneoplastic syndrome if you are middle-aged or older, you have a lung, lymphatic, ovarian or breast cancer. So these are the situations, complicated factors. Alright, so answer is mentioned in text A. Answer is A. So how many right answers? Yes, Maria, Sanila, Sarika, Swati, Shiji. Yeah. Yes. Fourth one. What objectives underlie the performance of neurological examination? So very simple question, even though you have no idea, okay, where they've mentioned about the objectives and performance, but you know neurological examination. So where is it mentioned? Neurological examination is only mentioned in this text. Which text? It is one of the diagnostic procedures which comes under text B, neurological examination. So answer is mentioned in B. So my answer or your answer is B. Right. Yes, Swati, Monita, Nitin. Very good, Nitin. Yes. Shiji, Sarika. Yeah, it's B. Fifth one. Organs typically succumbed. Okay, succumbed, which means it's a, what is the meaning of the word succumb? Give way. Yeah. So organs typically succumbed to the effects of paraneoplastic syndrome. So organs mentioned related to this syndrome, because of these organs related problems or something, it can lead to this disease condition. Where is it mentioned? Yeah. Yes, John C, which is text B, fourth one. Okay, Maria, text B. Yeah, so what about fifth one, guys? Yes, very good. Monita, Nitin, Sarika, Swati. It's mentioned in text A. So water, yes, Maria. So water, where they've mentioned about these organs here. See, paraneoplastic syndromes can impact multiple body systems and organs, including your nervous system, endocrine system, kidneys, bones, joints, skin, blood. So answer is mentioned here in A. Sixth one. The preponderance of malignancy of paraneoplastic syndrome. So, preponderance, not a very unfamiliar word to you. This is a very familiar one because we have done a lot of questions regarding preponderance, right? So, yeah, every time preponderance mentions the meaning of the word is prevalence or affecting that area of affecting this particular disease condition. That is prevalence or preponderance, yeah. Where is it mentioned? Preponderance. Yes, Sariga, very good. Answer is mentioned in text D, not in text A, which is mentioned in text D. Neurological, no. Here, reported frequency of paraneoplastic syndromes ranges from 10 to 15% to 20% of malignancies. Yeah, so that's here. Answer is in text D. Okay, malignancy. Seventh one. Yes, John C. Swati, Nitin, Rose, Maria, Sarika. Very good. Answer is mentioned in text D. So last one. Then we can decide how many of you got 7 out of 7. So frequently employed pharmaceuticals for diminishing swelling. So frequently employed pharmaceutical medicines diminishing swelling, inflammation. Diminishing, which means decreasing. So where is it mentioned? Decreasing your inflammation or swelling with the help of this medicine. Which medicine? So Yeah, medicines mentioned in, very good Sarika, medicines mentioned in text C, and one of the medicine is, I think it is corticosteroids mentioned, yeah. Corticosteroids, medications such as cortisone or prednisone that reduce inflammation, say keywords, diminishes swelling. A very direct answer from text C. Yes, Swati Nitin, answer is mentioned in text C. That is the correct answer. So now tell me in the comment box, anyone with 7 out of 7, I'll be so happy. Yes. Anyone with 7 out of 7 for Part A paraneoplastic syndrome? No. No 7? Okay. No one with 7 out of 7? Oh my god. I thought, yeah. Very good, Sarika. Neethu, very good. Yes, Neethu, George and Sarika, Mall, Jomon. 7 out of 7. Anyone else? No. Okay. Okay, Shiji, it's pretty good. Okay, 6 out of 7 is really good. Yeah, so 8 to 14. Yes, Helen, 6 out of 7. Yes, Siki, Vincent. I hope your pronunciation is correct. I don't know. Yeah, yes, Johnsy, 6 out of 7. 7 out of 7. Yeah, very good. Coming to, or I'm jumping to 8 to 14 set of questions, which are short answer questions. You can answer in 2 to 3 words. So, first one. Which specification of paraneoplastic syndrome is sporadically encountered? Encountered, which means you can face something. Sporadically, I can say, what is the meaning of the word sporadically? Specification, which means a type. Okay, sporadically, which means infrequent or not so common. Atra common alla. This is very rare. Okay, yeah. So the specification, which means that type of. So I think only one type of paraneoplastic syndrome is mentioned. I have no idea. I don't remember. I think so. And which I know is neurological something, right? Any idea? Any correct answers? Yes, Swati, 7 out of 7. Very good. All right, Sanila, 7 out of 7. Yes, Monita, 7 out of 7. Yeah, so I'm coming back to 8th question. Which type? A the type ആണ്. Which specification, which means here the meaning is which type. So which type of paraneoplastic syndrome is sporadically encountered, very rarely occurred. വളരെ rare ആയിട്ട് കാണുന്ന one of this type is here, and I think it's mentioned in text D. Any answers do you have? ഉണ്ടോ? No. Why? But why? So yeah, answer is mentioned here. Second bullet point. Neurologic paraneoplastic syndromes, that is one of the type. So neurologic are estimated to occur in fewer than 1% of patients with cancer. That is very rare. Not frequent. Infrequent. Answer is neurological. Very good, Shiji. Okay, answer is neurological. So that is the correct answer. And what about question number 9? Yeah. So what specific physiological responses and immune system functions are diminished in the body as a result of administering immunosuppressive drugs, and how does this impact overall immune resilience? So yes, these are my keywords. Physiological, diminished, immunosuppressive. Yeah, only 3 words needed, so I'm just rubbing resilience. So yes, any answers? Immunosuppressive drugs mentioned here in text C, I guess. Immunosuppressive, yeah, here. Any idea? Yes, Nathan, your answer is correct. Neurological, Shiji. Yeah, what about others? Kittili answer. So 9th one. So very simply, I can convert this question. I'll just convert the question in a very simple way. What does immunosuppressive drugs decrease in the body? Because of the immunosuppressive drugs, this particular thing can decrease. എന്താണ് അവിടെ decrease ചെയ്യുന്നത്? What is decreasing here? Immunosuppression drugs that decrease your body's immune response. See, already I've underlined the keyword. So without any doubt, I can mark it. This is my answer. Immune response. എന്താ പറയുന്നത്? Immune response. Answer is mentioned in text C. So my answer is immune response. Even though this is a very lengthier question, a very simple question, very direct answer. 10th one. Yes, Swati, you don't have to write decrease immune response. You can just write immune response, because instead of the word decrease, They've mentioned diminished here. But diminished in the already question, so you don't have to repeat the same. Answer is immune response. 10th one, criteria that are yet to be reported as the causative factors for paraneoplastic syndrome. So my keywords which are criteria, reported, and causative. So these are my keywords from the question. So factors nu parayumbo, you know that it's more than one, maybe 2 or 3. Yeah, so what are the causative factors regarding the criteria reported? So criteria, it's reported, it's mentioned I think here. And what are the causative factors? No race or sex predilection. Okay, so that is the causative factor mentioned here. So you can write race or sex. That's the correct answer. Don't write race, don't write sex. Answer is race or sex. Okay, so these are the factors. 11th one. So 8th one done, 9th, 10th. Text D. 11th one. In lumbar puncture. So lumbar puncture in the text, which means spinal something. What was that? Spinal tap. Spinal tap alai. Spinal tap is mentioned here somewhere. Yeah, spinal tap. In some instances, your provider may perform a spinal tap to test your cerebrospinal fluid. So answer is, I think, cerebrospinal fluid. Let's see. What is the question? I haven't read that question completely. So question is lumbar puncture, yeah, spinal tap. Which fluid? Yeah, correct answer. Answer is cerebrospinal fluid. Analyzed for the presence of antibodies. So answer is cerebrospinal fluid from text B, right? Yeah, text B, cerebrospinal fluid, yes. Okay, so you don't have to write here. Of course, you don't have to write that fluid there because already fluid there in the question. So you can write cerebrospinal. Yes. So the next one, yes, John C. Answer is correct. Yes, then your answer is right. John C. You don't have to repeat it. Okay, fluid repeat is now and allow. So answer is cerebrospinal. So are the same thing. You don't have to repeat. Answer is cerebrospinal. 12th one. What is the term for removing harmful antibodies from plasma affecting healthy tissues? So my keywords, term, removing healthy tissues or healthy. So what term? What is the name for that? What is the term for that? So what is the name for removing harmful dash and dash? Yeah. Yes, then it is plasmapheresis, which is mentioned. I have seen that word here in text C. And somewhere here, plasmapheresis, a procedure that decreases the number of antibodies by removing plasma. Direct answer. So answer is plasmapheresis. Yeah. Yes, John C, Sadiga, Nitin, Swati. Answer is correct. 13th one. What entity induces, which means bring about, konduvera ennulla meaning aanu, produce or provide, not produce, provide, alterations, changes in the body leading to symptoms unrelated to the cancer. Yeah. So induces symptoms, cancer. So what can give or what can provide, what can induce, what can bring about? I think which is here something related to tumor. So the symptoms occur when a malignant tumor triggers changes, alterations, the keyword, in your body that are not directly caused by cancer itself. Another keyword, not directly or not directly. So answer is malignant tumor. Malignant tumor. Okay, not a very direct answer, but still it's very easy, not that much difficult. So answer is malignant tumor. Okay, so what about others? Orangio? No. 14th one. Amongst which demographic is the likelihood of developing paraneoplastic syndrome more pronounced? My keywords, demographic, developing, pronounced. Yeah. More pronounced and varna here, pronounced doesn't mean that you're pronouncing something. Here pronounced, which means it is affecting. ആരെയാണ് കൂടുതൽ ഏജ് ഗ്രൂപ്പിനെ ആണെന്നല്ലേ? Yeah. More affected. ആരെയാണ് കൂടുതൽ അഫക്റ്റ് ചെയ്യുന്നത്? It is affecting, I think it's mentioned in text A, I guess. Yeah, middle-aged or older. So answer is middle-aged. See, middle-aged എന്ന് പറയുന്നത് it's not a two word, it is a single word because it is connected with this thing called hyphen. So middle-aged or older. You have to write middle-aged or older. Yes, Nitin. Hyphenated word should be hyphenated, so please do put a hyphen in between middle and aged. Kata. Sharika, it's not old. Old age actually correct. Your answer is correct, but what is mentioned in the para is middle-aged or old age. Older, not old age, older. So you can write middle-age or older. Whatever they have mentioned in the passage, you can write down that. All right. So that's that. So I'm just jumping to 15 to 20. So first one, it is estimated that dash of patients with cancer or less may manifest perineoplastic syndrome. So anticipated cancer manifests. So what is the correct answer here? Anticipated. Estimated something എന്തോ ആണ് അവർ മീൻസ് എക്സ്പെക്റ്റഡ് ടു അല്ലേ, ഇങ്ങനെ പ്രതീക്ഷിക്കുന്ന എന്തോ സംഭവം. നോട്ട് എക്സാക്ട്ലി ദിസ്. അപ്പോൾ എത്രയാ? Neurologic perineoplastic syndromes are estimated, anticipated to occur in a fewer than 1% of patients with cancer. So answer is 1%. You can write down there, not less than or something, because already it is mentioned less may manifest. So answer is 1% from, oh my god, text D. 16th one, in a dash, a needle is adaptedly inserted into the lower back, extracting the fluid or subsequent antibody testing. So, what about question number 16? In a dash, in a what? Needle is inserted. I know it's a procedure, right? So, which procedure? Yeah, therapy is mentioned here. Sorry, yeah, here, diagnostic procedures. And needle is inserted. During spinal tap, your provider inserts a needle into the lower back. These are the keywords, right? So answer is spinal tap. This is the procedure. So spinal tap is the answer. Yes. Okay, Sarika, what is CSF? CSF and the? What is that? CSF? Yeah. I didn't get that. Anyway. So yes, Nitin, answer is spinal tap. 17. Perineoplastic syndromes affect multiple body systems and organs, including the nervous and dash, kidneys, bones, joints. Very direct answer. I know this is from text A. All right, and answer is yes, John C. Spinal tap is the answer. So what about question number 17? So these are the things: kidneys, bones, something is mentioned. So answer is endocrine system, right? Yes. Endocrine system is the missing word or missing words. Endocrine systems. Yes, so are they spinal tap? Previous one. And 17th one is endocrine system, which is mentioned in text A. 18. You may be tasked with specific exercises to gauge alterations in dash, prowess and dexterity. Dexterity, yes. So where is it mentioned? Alterations in dash. Alterations in what? എവിടെയാണ് changes വരിക if you have this condition? I think it's mentioned here in text B under diagnostic, because neurologic എന്നല്ലേ പറയുന്നത്. So provider check your nervous system functions. They will want to judge any change in your abilities related to strength, memory and coordinating. So answer is memory. Okay, strengthum coordinating അവിടെ പറയുന്നുണ്ട്, but it's a very entirely different words. Okay, that is dexterity, which is coordinating and prowess. So answer is memory. Okay, that is the correct answer. And 15th one, second last one, in the domain of physical and speech therapy, elucidate the intricate manner in which dash serve to enhance functions like speech and movement. And what about 19? Yes. It is muscle exercises, which is a very direct answer from text C, and is mentioned here in the physical and speech therapy, muscle exercises that can help improve functions like speech and movement. A very direct answer. And answer is muscle exercises. So that I'm coming to the last one, 20. Utilizing dash, the healthcare provider can strategically eliminate the possibility of underlying conditions contributing to the symptoms. Yes, Nitin, John C. So finally, Nitin and John C. മാത്രമേ ഉള്ളൂ. What about others? 20. So 20th question is blood test. Blood test is mentioned in Text B. Yes, one of the diagnostic tests. Blood tests can reveal suspicious findings such as that suggest a tumor or that confirm you have an antibody linked to paraneoplastic syndrome. Blood tests can also help your provider rule out other conditions that may be causing your symptoms like an infection, a hormone disorder or metabolic disorder. So answer is blood tests. Not blood test or S kuda undu. If you are not writing that S there, your answer is wrong, okay? Yeah, John, it's not blood test, dear. Blood tests. Yes. Every answer correct. It's wrong. So sorry. Blood tests. TESTS. Yeah. So anyone with 20 out of 20? Please let me know in the comment box. Anyone with 20 out of 20? No, 20 out of 20. So that's all about today. So please stay tuned. Same time tomorrow. So take care. Thank you. Good day.